that has to be distinguished with something called dynamic visual acuity, which is the ability to identify an object when there is a relative motion between the observer and the object, and things such as reading street signs while driving. We know that that tends to decrease after 50, probably due to muscle control, which has to do with basically what we call oculomotor control. At present, though, this testing is not done clinically, and so while we know that dynamic visual acuity is more related to driving than static visual acuity, at this point in most eye doctors' offices, this isn't tested. This is really more used for research purposes. We talked about central vision. We're going to look at peripheral vision because these are really the two tests that most eye doctors will test for. Peripheral vision generally starts to decrease around 55 years of age, and we know with some of the research that crash rates are twice as high among those with binocular field loss than without. And so we've got a situation where as the field decreases, we may in fact notice an increase in crash rate. Interestingly, there was an article that was written a couple of years ago on cell phone conversations. Obviously, we have a lot of those going on, and what happens is it constricts the peripheral awareness. And so when you constrict peripheral awareness, it makes the driver less aware of the surrounds and more susceptible to accidents. And we know from the literature that more than 5,000 deaths each year are from cell phone related instances. So this is the kind of thing that we've got to pay attention to. There's another field loss.
Can I ask you a couple questions?
Absolutely.
Sorry to interrupt. One of the questions is from Bert Thompson. He has read and been advised that 12 to 15% of people 70 plus will have macular degeneration. Is this accurate? Is that figure correct?
Actually, it's probably a little low, but macular degeneration increases the older we get.
Okay, so it increases the older we get.
As we get older, it increases. It's kind of like a birthday gift.
Okay. And that doesn't sound like a good gift to me. So two people, Cynthia Phillips and Bob Schneller. This is, I think, a great question. Are there any natural exercises that we can do to strengthen our eyes to help maybe reverse some of the effects of aging on our vision?
Some of the anatomical changes, I don't know that there are any exercises per se. There is an aspect in optometry called behavioral vision that includes activities, visual therapy activities that will incorporate eye movement skills, eye-hand skills, eye-foot skills, reaction time, and so there are activities that people can search for doctors who do behavioral vision activities. If anybody's interested in that, they can contact the American Optometric Association or the state optometric societies and ask for those doctors specifically, and they'll get a list of those doctors.
We still have a couple more questions because this is good timing for these questions. This one's from Patricia. She says that now when I look away from the road, I tend to veer in the direction I'm looking. Why is this happening to her?
You know, that's an interesting phenomenon, and that's a very accurate perception. You tend to veer in the direction that you look. It's really related to eye, vestibular, and neck position. And so it's important, if someone knows that, to try to use just a kind of a visual look as opposed to a complete body look, which is what it sounds like she's doing. But we see that a lot, that veering activity with any number of pathologies as well, not suggesting that this person has any pathologies.
Okay. And Dr. Freeman mentioned some exercises possibly for strengthening your eyes. This is a question about technology. This is from Henry Solomon. Won't technology like smart cruise control, lane departure warning, side radar, heads-up displays, and other options help the older driver?
The answer is yes, providing we can still simultaneously process these things. I think if we can't divide our attention, and we'll look at that a little bit later on in the presentation, I think what those will potentially can do is give people false senses of security. I just want to make one point. When we're talking about the eye exercise, we're not strengthening anything. What we're doing is we're increasing reaction time and accuracy.
Okay. I think that...
Okay, we can keep going because there's one other thing I want to talk about. There is something that we notice, and this happens a lot from patients that we see with stroke. Sometimes they have what's called a total side vision loss or hemianopia, and in those situations, there can be some problems. Now, if you'll notice here on the next slide, you'll see that half the field goes away after you've kind of gotten a good view of that area. Someone with a field loss, a partial field loss, and it doesn't come on as one's driving necessarily unless they've had a stroke, but you can see that somebody can have difficulty reacting to bikes, other vehicles, pedestrians, steering in a straight line, and incorrect lane positioning. And interesting, that last speaker kind of almost led into this. If someone actually had that left loss, which is what we're looking at there, if they started to look to the left to try to see where they were going, they might veer to the left. So I think that that last speaker was pretty much kind of gave me the lead into this presentation. So that's our peripheral vision. If we look at fixation and scanning, because we've got to obviously locate targets, there's no age-related loss of the ability to fixate a stationary target. And that's good because that's really how we describe static visual acuities, by being able to fixate a stationary target and know where it is and know what it is. As we get older, that fixation can decrease when targets start to move fast, and there are competing targets, so we've got this figure ground issue. And so that's kind of the comparison, if you will, between static visual acuity and dynamic visual acuity, where one is stationary and one is moving. And finally, the ability to shift fixation is reduced and reaction time is slower for older observers. Now, what's interesting about that is, and we had a couple callers talk about that, how do I make sure that I can do that? Well, the first order of business is to make sure that eyeglasses, eye health, are up to as best they can be. So once we've got that under our wraps, then we've got to be able to start to move back and forth. And again, for some of the callers, there are some exercises one can do, specifically to improve fixations and fixation speed and accuracy.
One quick question. This is from John Behringer in California. Would you define binocular field of vision?
Binocular field of vision is when both eyes are used simultaneously and there's overlapping fields. So in theory, if you have a good full binocular field, you should be able to see pretty much from ear to ear. The time that it's a problem is if there are losses in the field and where the losses are, and if they are the same loss in the same spot, as we had in that hemianopic field or that side vision loss, where the side vision was lost on the same side in both eyes.
And a question on peripheral vision. This is from Gary Smith. What is the normal peripheral vision in degrees for a 65-year-old?
I can tell you the normal visual field, and it's going to vary some. It's anywhere between 90 and 110, kind of off to the ear side. Some people can actually see a little bit behind their ear. It's about 60 toward the nose, 60 inferiorly, and about 45, 50 superiorly. And now that's going to vary, and so it varies with a lot of things, and sometimes it varies even with the type of test that's being done. The other issue there is sometimes it varies when we do those tests because someone has to respond to a clicker, as an example. Mm-hmm. You can see it, but if you don't click fast enough, it looks like your field's constricted, and it will be constricted not because it is, but it's artificially constricted because of the speed of the reaction time, and that by itself would suggest that somebody needs to pay attention when they're driving. As a friend of mine told me, if you have 20/20 but it takes you 20 seconds to get there, that can be a problem.
Right. Okay. A couple more questions before you move on.
Absolutely.
We talked a little bit about, we asked you if there were any exercises, those kinds of things. Barbara Green would like to know, are there any vitamins that can help with your eyes and ultimately your vision?
Most of us believe that vitamins, specifically vitamins that concentrate on antioxidants, will help. And basically, those are the nutritional ways to try to slow down, if you will, some of the changes. And again, the American Optometric Association has a section on nutrition. And so if someone's interested more specifically on that topic, that they might want to contact the American Optometric Association. Okay.
And conversely, from Charles Fitt, do stimulants like coffee or tobacco affect your night driving?
Well, I hope coffee doesn't because I drink a lot of that. And I think that tobacco is probably not a good idea right across the board. So I don't know any specific research to suggest that either one of those is probably not necessarily bad or good.